Hi, I'm Dr. Marlynn Nunez. I'm from Body Logic MD of Miami. I'm originally OBGYN. I was born and raised in Puerto Rico, where I did my med school in Puerto Rico and my residency training in OBGYN in Puerto Rico. After that, I ended up moving to the States. I see a lot of women patients, mostly from their 30s on. When they start with the perimenopausal symptoms, they feel irritable, they feel tired, they feel depressed. They are labeled a lot of things, and they're giving a lot of medications, like they're giving antidepressants and 20 different medications for things that are very simple to solve, just restoring their hormone balance. We check not only their estrogen and their progesterone, but also the rest of the hormones that the body produces, like cortisol levels, which is very important. We do that through saliva testing. We also do some blood work to check the thyroid and different tests to check the patient's wellness all around, their insulin levels, their fasting blood sugar, and even their cholesterol levels. There's also more specialized labs that we can do, like for metal toxicities and Nutrivol, which will evaluate every vitamin and mineral in your body and see what you're deficient in, so we can customize your supplementation and get you to an optimal level. A lot of patients come in because they want to lose weight. A lot of patients in their menopause, they start putting on weight in their lower belly and they can't seem to lose the weight like they did before, and they start putting on this weight and they want to get rid of it. And then when we look at their hormones, not necessarily the only problem is the hormones related to menopause, but also their cortisol levels because of their stress. And the body starts stealing progesterone to produce more cortisol. And by doing that, the cortisol hormone is going to gain weight in your belly area. So we need to fix that for that diet that we're going to also recommend for it to work on them. And once everything is balanced out, these patients start losing weight. In our holistic approach, we not only recommend the dietary changes and the supplementation, but also we recommend, especially in patients who are under a lot of stress, and that is pretty much everybody. Exercise is a good way of dealing with it, but it's not the only way. There's other ways like yoga, Tai Chi, Qigong, meditation, prayer, that will help your stress levels come down, and it's something that needs to be done every day or at least a few times a week so you can compensate. On top of that, we also offer, in patients who need the supplementation for their adrenal glands, we also offer that type of treatment to help with their adrenal fatigue.
About 2 years ago, it just seemed like everything started to just fall apart. I all of a sudden started feeling like I was 90. My body was achy, everything snapped, crackled, and popped when I moved. I was cold all the time. I just was not right. And one of my girlfriends was doing the bioidentical for different reasons and all that, and so that got me curious. I'm the type of person that reads up on everything, wants to know everything about anything I do, and so I'm like, oh, that's interesting, I'll have to start reading. And so I started reading. I got some books on it. I started reading them thinking, geez, this all just kind of fallen right into place. It totally makes sense. And so I had done a search for somebody that did bioidentical. I didn't want to take any of the synthetic crap. So I went and got all my labs done and did everything, and I went in for an appointment, and I was really surprised at how out of whack I was. And one of the things that never crossed my mind was my thyroid. And I had been tested before for the TSH levels. Nobody's ever caught it because it always shows up normal. Well, she was totally on top of the new thinking of it's not just that number, but it also has to do with these other numbers that most other doctors don't even check. And as it turned out, was the case. I wasn't converting some enzymes, so I was hypothyroid, but didn't even know it, and it wouldn't have been, no other doctor would have known it either. And so sure enough, she put me on the thyroid, and that one was probably the biggest difference. I mean, it was amazing. All of a sudden, I got up out of bed, and the snap, crackle, and pops all stopped. I was just like, wow. Just the deep aching in my body all went away. The weight started coming off. Doing the things that I normally do, I'm almost back down to my normal weight. I feel like I'm 35 now. Instead of feeling like I'm 90, I actually feel younger.
If you want to know more about my practice, you can check online on bodylogicmd.com, go under the state of Florida and check under Miami, and that's where you will get more information about my practice.